JAIM Journal Club event. A journal club is an educational meeting in which we sit together to discuss the published articles, and it provides a forum for a collective effort to discuss and learn further. I, Dr. Charu Sharma, coordinator JAIM Meet, I welcome you all on the behalf of our whole team of Journal Club, Journal of Ayurveda and Integrative Medicine. It has been more than 1 year, and this event is being successfully organized under the leadership of Professor Dr. Girish Tillu sir, Surya Bhalerao madam, and Kishore Patwardhan sir. And we also have Dr. Vinay Pawar sir, Associate Professor D.Y. Patil, Deemed to be University School of Ayurveda, Navi Mumbai. And in our expert panelist, we are very fortunate to have Professor Prahlad Patki sir today. He's a senior pharmacologist from Bangalore. He's teaching medical pharmacology to international medical students and formerly head medical services at the Himalaya Drug Company. Sir has an extensive experience in the research of pharmacology. He has been working as a clinical pharmacologist, was experienced in basic and applied drug research, including vaccines and nutraceuticals, leading a team of biology researchers in vaccines. We welcome you, sir. And today we also have Supriya madam with us, Associate Professor, Interactive Research School of Health Affairs, Bharatiya Vidyapith, Deemed to be University, Pune, and Associate Editor, Journal of Ayurveda and Integrative Medicine. We welcome you, ma'am. And last month, we had a discussion on Manikya Bhasma as a nanomedicine to affect cancer cell viability through induction of apoptosis. And Dr. Tejo Krishna Kure from Department of Rasashastra and Bheshaj Kalpana was a presenter last month. And today we have with us Dr. Sushma. Dr. Sushma NS is Assistant Professor and Research Officer at Amrita Vishwa Vidyapeetham, Amritapuri. And she will be presenting an original research today, effect of Vidania somnifera, hydroalcoholic extract, and other dietary intervention in improving muscle strength in aging rats. Namaste, Dr. Sushma. We welcome you here, and you can start with your presentation.
Thank you.
Thank you.
Is it audible, ma'am? My voice is audible, ma'am?
Yes, yes, yes.
Screen is okay, no? Fine, no, ma'am?
Ji.
Good afternoon, all. I am Dr. Sushma, working as Research Officer, Acharya, Amrita School of Ayurveda, Amrita Vishwa Vidyapeetham, Kerala. First of all, let me thank all the organizers of this program to give me the opportunity to discuss critically about the paper. This is indeed very helpful experiences and exercise and need for the hour, especially in the Ayurveda fraternity. I also use this opportunity to thank all the authors of this paper who have taken all the pain to publish this such a wonderful work. Today, for the 15th session of this JAIM Journal Club, I have selected an experimental animal study for the discussion. This is the paper, Effect of Vithania somnifera hydroalcoholic extract and other dietary interventions in improving muscle strength in aging rats. You see the title, the intervention adapted by the author is Vithania somnifera extract and also dietary interventions. Area of focus is weak muscles in the aged rats. And the outcome is author want to see whether this intervention is helpful in treating the condition like weak muscles or less muscle mass, loss of muscle mass in the age. So the author of this paper is Vandana ma'am from Department of Pharmacology and Toxicology, and Aswari Hare sir and Sneha Singh ma'am from same department, Mumbai, and Amol Deshmukh sir and Lal Hingorani from the Department of Research and Development Department, Anand, Gujarat. The corresponding author of this paper is S. Sudhamani from the Department of Pathology, Dr. D.Y. Patil Medical College, Navi Mumbai. And this paper published online in JAIM on November 9, 2021. I would like to seek blessings of Vandana ma'am and all the author of this paper to bless me to present this paper. And I request their sincere guidance and advice if ever, whenever necessary during the presentation. Okay, let me explain the rationale behind the intervention and focused area selected by the author in this paper. Author explained in the paper that loss of skeletal muscle mass and decline in function during the aging start at the age of 40 years, and the rate of loss of skeletal muscle mass and decline its function will be increased 1 to 2% per year after 50 years. So this process of aging will result in some of the complications such as falls, fracture, functional disability, loss of independent living, and mortality. In view of this aging process, this study is designed. In the paper, author first find what is the cause for this aging process, which results in the weak muscle mass. So he compiled it as some of the reduced muscle protein synthesis, low protein in the diet, impaired protein absorption, and lack of exercise. So these are the causes. Hence, to combat these conditions, the intervention selected by the author is novel herbal extract such as Ashwagandha and some of the protein supplements. Along with this, resistance exercise also added as the intervention to see the whether these will strengthen the weak and aging muscles in the age, during the age. So let me go through the methodology adapted by the author in this paper. The normal rat muscle will attain the sarcopenic muscle changes at the age of 12 months. So biochemical analysis shows there is a increase in inflammation, oxidative stress, apoptosis, BAX, blood glucose level, and significant decrease in grip strength, total protein, and BCL2. So author has selected these, I can say this combination or variety of intervention group. First group is the 500 mg per kg Vitanis hominifera, considered as group 1, and the group 2 protein cocktail, which is the combination of soya bean and quinoa. In the third group, this is nothing but the combination of first and second, where ashwagandha plus protein cocktail taken together in the combination form. That is in the fourth group, whey protein itself is taken as the group here. So in the paper, author mentioned it as a reference group or standard group. The fifth group, only resistant training were given. In each group, 6 each animal rat were selected for the study. So I can say that these 6 group, where 6 each animals were taken as the compared group of aging 12 to 13 months old were selected. In the control group, 2 control group, 1 2 to 3 months old young rats and the age 12 to 13 months old rats. Like these 2 control groups are selected for the study. And these interventions are given to the animals till 60th day. And these are the biochemical assays estimations done. You can see the first grip strength and blood glucose levels were assessed on the day 1, 15, 30, 45, and 60th day. Rest all the biochemical estimations were done after the 60th day. At the result proportion, author is saying that there is significant decrease in the inflammation, oxidative stress, apoptosis, blood glucose level, and significantly increase in this grip strength, total protein, and BCL2. Let's go to the methods and materials. So in the why author has selected Ashwagandha for this as a one intervention group. Sorry. Okay, you can see here. So Ashwagandha is mainly, it mainly elevates the age-related muscle weakness because of its anabolic effect, antioxidant, anti-inflammatory, and insulin secretagogic and anti-fatigue effects. And it strengthens the muscles because of its anti-stress, adaptogenic activity, anti-inflammatory effect, and potent antioxidant effect. And it also improves muscle mass because it decreases the cortisol level. It helps the maintenance of mitochondrial function, and it increases the focus and concentration, and it's good for the better muscle recruitment and coordination. And phytochemical analysis of these Ashwagandha herbal extract was done. The content shows percentage of methanoloid glycans, methanoloid glycosides, and total methanolides. And these interventions are administered orally to the experimental rats by dissolving 500 mg per kg ashwagandha in the distilled water. Let's see other two group, that is protein cocktail and whey protein powder. Let's see what is the rationale behind this, why author selected this. In the paper, author is explained that quinoa is slow release protein, whereas soya bean is fast release protein. And quinoa has got all 9 essential amino acids, and it is rich in leucine, whereas soya bean also has leucine. Along with that, it has arginine, which is very much essential for the muscle formation. And it has one more extra, like phytic acid, which is act as an antioxidant and anti-inflammatory in the study group. The third group is whey protein. It's taken as a standard or positive or reference group in the study. And it is fast release protein, and it is also essential in the amino acids. So while explaining the rationale, author is telling all these protein group which is selected for the study is rich in amino acids. Hence, it helps in the, which is required for the muscle protein synthesis. And nutrient value of all these protein supplements were assessed in the paper: total calorie, total fat, total protein, and total carbohydrate. And this soybean and quinoa were roasted, cooked till soft, and mixed and made into bolus and fed to the aging rats. Whereas whey proteins were dissolved in distilled water and administered orally to the experimental group. The fifth group is selected is as the resistance training group. This is nothing but physical exercise. So author is telling that the rationale behind selecting this group is because of the physical exercise, the muscles get contracted, thereby it triggers the rapamycin complex pathway. So hence it stimulates the protein synthesis and helps in the build of strengthening of the muscle and increase the muscle mass. And he also emphasized that along with the physical exercise, adequate protein ingestions will lead to significant lean mass increase. The steps involved in giving this training to the animal. In the first week, author without adding any weight on the body, allow the animals to swim for 10 to 15 minutes. And in the second week, 5 grams of weight is strapped around the animal body, and it made to swim for 5 to 15 days. Gradually, the weight is increased from 5 to 15 grams, and for allowed to swim for 15 minutes. So the ultimate plan to see whether these exercise will empower the weak and aging muscles. Let's see the experimental model used by the author in this study. So here mainly male spread dual rat strain is used for the study. So here in the paper, author is explaining that 12 to 13 months old rats corresponding to a human age of 60 to 65 years. For the young age rats selected as control group, which is 2 to 3 months old. And in the study, author is explaining that the low muscle strength, here the model is selected, such animals which have low muscle strength due to natural aging. So this natural aging is not induced by any chemical agents. So it will represent the real-time loss of muscle strength and physiological and biochemical changes associated with it. So this is the group experimental procedure. So the first 2 is considered as a control group, where young and old rats were kept for this group. And other 5 group is considered as compared group, where you can see that in one group only ashwagandha is given, the second group only protein cocktail is given, in third group these two are combined together, and the fourth group is only exercise is given, and the fifth one is the whey protein. For all these group, standard diet such as chore diet and drinking water supplied throughout the study period. Let me explain this introduction, outcome, and result portion explained in the paper in one single slide. As you see this, here these oxidative stress, low protein intake, AMPK enzyme, low grade chronic inflammation, insulin resistance. All these are the factors which influences the aging process. So author has gone in bit detail to explain this concept. On the basis of these factors only, outcome measure is selected for the study in this paper. See, in the oxidative stress, it will, because of the stress, it reduces the muscle protein synthesis and mitochondrial dysfunction results in muscle atrophy. There is low protein intake in the diet or impaired protein absorption also results in muscle weakness. Increased elevated level of AMPK will suppress the muscle protein translation and synthesis. Hence, it causes a diminished skeletal muscle growth and muscle atrophy. Low grade chronic inflammation after the mitochondria, it will changes the adversely affect the mitochondrial functions, hamper the muscle, results in the muscle atrophy. Whereas insulin resistance and hyperglycemia condition also will hamper the muscle mass, muscle strength, etc. So totally, I can say this: all these factors ultimately results in the sarcopenic changes in the aged muscles. So to assess all these factors, author has used biochemical estimation assays respect to each factor. So see the oxidative stress, LPO, TBRS, GCSH, SOD, CAT, ROS oxidative markers are used, whereas in the low protein intake, total protein is assessed, AMPK levels were assessed, and inflammatory markers such as IL-6, TNF-alpha, and CRP is used to assess the level of inflammation in the animal, and insulin resistance and hyperglycemias are assessed by using the insulin assay and blood glucose level assays in the studies. Add to that, two more factors also influences in the sarcopenic changes. One is reduce exercise. So here, reduce exercise will result in the it will alter the protein synthesis and muscle hypertrophy, thereby hamper the muscle strength and functionality. And also, author identified two apoptic signaling, which BAX and BCL2 protein, which indirectly causes the muscle degeneration. Hence, results in sarcopenia. To assess these factors, author has used grip strength. By using the grip strength meter, this is assessed, and gene expression of apoptic regulators, BAX and BCL2 is assessed in the studies. So ultimately, at the end, the results says that all treatment groups, these 5 groups which I explained right now, is showed successfully attenuated aging elevated glucose such as CRP, inflammatory markers, and apoptic regulators, and significant restoration of the aging depleted total protein levels and all the antioxidant parameters and BCL2, and an increase in grip strength and greater biceps muscle mass. And hence, author conclude that the group, which is taken as a combination of Methanoes somnifera with protein, is elicited the best result in the study. So this is the first half of my presentation. The second half of my presentation, I will critically analyze these findings and methodology adapted by the author in the study. I'll use two criteria to do this. 3 R's and ARRIVE guidelines. In 3 R's, it is principles of good science designed by scientists to improve animal welfare and scientific accuracy. Whereas ARRIVE guidelines is considered as a good reporting system for all in vivo experimental studies. So before going to these two criteria, first I want to explain the paper published by Sachitano 2018. According to his paper, the factors responsible for the aging involves all these factors. Totally 10 factors are involved here. Whereas I'm happy to say that in this paper, except these 3 factors like decreased hormone levels, altered heat, shock protein, impaired muscle regeneration, except these 3 factors, rest all these 7 factors are considered in this study. So I feel this is the richness of this paper, which gives the total idea of the mechanism and effect of ashwagandha in slowing the age, weakness, and loss of strength in the aged rat muscles. And let me go to the criteria one. First criteria I'm going to explain is 3 R's. It includes 3 factors: 1, replacement, reduction, and refinement. Let's go one by one. Let me explain what exactly refinement means. Refinement is nothing but providing such an environment so that it will, animal leaves will be good, better in the labs. And it may include providing some of the toys or some of the good food as such. And it also include better training for the technicians also in this refinement criteria. And if I see in this paper, all these refinement criteria is followed in this paper by the points of humidity controlled in the cage and the dark and light cycle maintained in the cage, and the temperature is well maintained in the cage, and 7 days of acclimatization is provided, and also the standard diet and drinking water is provided to the animal. So I can say that the refinement criteria is fulfilled in this paper. Let me go to the next criteria. Next point is reduction. So here, using as few animals as possible to get a good results, that points come under reduction. If you see in this paper, the author has selected 7 groups, that is 5 compare group and 2 control group, each group 6 rats. So totally I can say 42 animals are selected for the used for this study. So always it's based on the statistical point. On that base, actually sample size is decided. But in the paper, what is the method is adapted for confirming the sample sizes. I didn't mention actually. And also, I had a doubt about whether these 7 groups are necessary. What is the rationale behind this? Why these combinations are made? And what is the rationale behind combining the dietary nutrition with Vitaenia somnifera? So these rationale were missing in the, is not seen in the paper. Because I feel this is genuine to know, because in the if you see the result portion, all the compared groups show same result, and author is explained in the paper also, conclusion and discussion portion also. All the groups shows the same results. So there is no much difference. That's why I raised a question whether what is the rationale of using all these different combinations and these many groups in the study. The third points comes in the R's is replacement. So here we have to give the strong justification why I selected animal or experimental study as an animal in this study. Is there any alternatives are there? So these questions should be satisfied for this replacement criteria. So in the body of the paper, author has mentioned one paper where the efficacy of Vitaenia somnifera shows very good results in improving muscle function and when the resistant training is given for 2 weeks. Hence, the point, this is the point. So it shows that there is an alternative for this study as such. To get a more clarity on this point, I had done some of the literature search on the clinical trials on Vitaenia. So in this, I got 13 papers. Out of 13 papers, you can see up to 10 are done in the age group of the middle-aged populations. And all these studies are done to assess the muscle strength against resistance training. And if you see the last 3 papers, which is equal to our age group selected for the studies. So when I gone through the paper, in this actually 3 paper, the effect of Vitaenia somnifera is assessed on the, one paper is assessed on stress level, anxiety level, and sleep level, and psychological and physical levels of the people. Hence, the study involves here, hence this is not the, this age group, in this age group actually age-related studies were not done so far. So I can say this is the paper where animals were used to assess the and see the mechanism of effect of action of vitamin in the prolonging the change attributed to the muscles due to aging. And one more point I want to highlight here, the outcome measures selected by the author in this paper is all these many things, all these biochemical assays and estimations are done. But if you see this, most of the procedure employed in the study can be done in human trial, except histomorphological study. So also ashwagandha can be safely given to humans, as I saw these slides where many clinical trials are already done. So question arises to ask, could this not be done in humans? So this is the one clarity we need in this paper. And as I mentioned, the model used for this animal study is male strain. So what is the rationale of selecting this strain is not explained actually in the paper. The Christian CJ published a paper in 2020. In his paper, it is mentioned that like humans, mice and rats also have a muscle stem cells and are thus well studied for studying the possible contribution of an age-related decline in muscle regeneration to sarcopenia. So hence, this is the rationale which I feel genuine to mention in the paper. Okay. So while explaining the mechanism of rationale of resistant training, author highlighted and emphasized the combination resistant training plus adequate protein ingestion and its effect on increasing lean mass. But if you see the result area, result portion, there is a, in the RT, resistant training group, the total protein level is very less, decreased. So this is maybe because while doing the grouping of the animal, the author has selected the group which is not the combination of protein, instead it's alone group which only resistant training were given. So maybe this is the cause why in the protein level is reduced in the resistant training group. So it would have been better if you had a resistant training plus protein group in this study. And one more thing, while explaining the causes for this, author explained that reduced muscle protein synthesis, low protein in the diet, and impaired protein absorption is also one of the cause which results in these weak muscles and muscle loss in the aging. So food convergent ratio plays an important role here, which is not seen in the paper, because in this ratio, we'll see how much is the food intake, how much is the fecal output, and how much is the increase in body weight. So all these parameters help to understand this ratio. So this is not seen in the paper, as the impaired protein absorption plays an important role in this mechanism. And in the objective part of the paper, this study evaluates vitamin somnifera and some dietary intervention to combat muscle weakness in aging rats. So here in the object portion, author mentioned the word weakness, whereas in the conclusion portion, you can see that the resistant training will maintain the muscle mass and strength is explained, and the combination of one group, that is vitamin somnifera plus protein, is very helpful in maintaining the muscle power is mentioned, and also the term like muscle weakness, muscle functionality. So all these terms are mentioned in the paper wherever necessary. And while explaining the methodology and introduction and discussion portion, this concept is developed on the basis of the factors which is resulting these mechanisms. So wherever necessary, all these terms are explained by the author. But when we see the title of the paper, effect of Vitaena somnifera hydroalcoholic extract and other dietary intervention improving muscle strength. So here the only one term, muscle strength, is explained. But in the, if you see the paper, graphical abstract portion and the result area, the word sarcopenia is mentioned by the author. So in the other reference paper, sarcopenia means is the combination of three criteria. One, loss of muscle mass, and loss of muscle functionality. Hence, all these three criteria are very well explained and assessed with the biochemical estimation and assay. Hence, I feel instead of muscle strength, author would have kept the name, change the title as sarcopenia in the paper. In the conclusion part, as a takeaway lesson, the right diet, including protein, oxidant, and antioxidant and resistant exercise, is the key to combat muscle weakness during aging and retain the skeletal muscles functionalities mentioned. So in the end, actually, the intervention with Vitaena is not mentioned at all. Even the author claimed that the combination of Vitaena somnifera with protein cocktail gives the best results. In takeaway lesson, actually the intervention with Vitaena or Ashwagandha is not mentioned. These are some minor errors seen in the paper. While displaying the grip strength, author has mentioned day 1, day 14, day 28, day 42, and day 60. But actually, it should be 30, 45, 60. So there is some mismatch between the discussion portion and the result area. And in this graph, you can see that it should be the while mentioning the group name here, Vitaena somnifera plus protein is the group intervention group selected for the study. But author here he has mentioned Vitaena somnifera plus Bay as one group. So such group is not included in the studies. These are the minor mistakes seen in the paper. And the second criteria I want to explain. Analyze this paper on the basis of ARRIVE guidelines. So let me say what exactly ARRIVE guidelines is. It has got two parts, essential part and recommended set. In the essential portion, it has got 10 checklists. Okay, so it basically, if we want to publish a paper, it should be follow these guidelines. Otherwise, it won't have weightage. This is what is said in the description portion. For the, let me explain this first portion, essential portion. So this 10 checklist for the convenience and to assess, to see each point is present or not in the paper, I had subdivided into 30 items. So by analyzing the paper, there is 13 items were missing in the paper, whereas 17 items were mentioned by the author of the paper. So for today's presentation, I will mention only those criteria which are missing in the paper. The second checklist is sample size. So you can see here, sample size is the second checklist actually. For assessment, I subdivided the sample size into these 5 categories. So here, exact number of experimental units are not mentioned, and total number of animals, that is 42 number of animals. This number is not mentioned. This minor mistakes, and how the sample size is decided, that is not mentioned. And also the calculation, sample size calculation also not seen in the paper. And the third criteria which is missing in the paper is inclusion criteria. Even though author mentioned the age and weight and strain which is used in the study, but there is some specific points which is mentioned in the guideline is not seen in the paper, like specify the criteria were established prior, that is missing, and for each experimental group, report any animal or experimental units or data points not included in the analysis and explain why. If there were no exclusion, state also. So both things are not mentioned in the paper. And these are the very important 2 points, randomization and blinding, which is missing, which is not seen in the paper. because randomization is very necessary to avoid our choice. Whereas in this paper, author has taken 7 groups. So if at all randomization checklist is followed, it might have give the much value to the study. And the blinding. Blinding is also very essential, as you can see in this paper actually, for the resistance exercise, grip strength is the measuring tool kept for this. To avoid bias in the result, measuring blinding is very much essential. And some of the paper published by Bebata at year 2003, it's mentioned in the paper, if the randomization blinding is not done in the paper, we can see the difference between study group in the results. That's why it plays very important role while we do the animal study. And other 3 criteria, outcomes measures, statistical methods, and experimental animals. These 3 criteria were not present in the paper. And the second set in the guideline is recommended set. In this, actually in the background, it has got 3 more points. All those 3 points were explained. Only the scientific objective behind selecting animal species model used is not addressed in the paper. And in the objective portion, research question is not seen in the paper, and also hypothesis. And if you see the animal care and monitoring, what is the steps or protocol taken to reduce pain or sufferings and distress is missing. And what are the expected and unexpected adverse events during the study time period is not mentioned. And it's a very important point is human endpoints. If the study did not have human endpoint, state that. If it is, there is a point, then that should be mentioned. So both these points are missing in the paper. And interpretation and scientific implications, limitations. What is the limitation of the animal model selected for the study, impression associated with the results. These points are not seen in the paper. And translation, the finding of this study are like generalized, what is the relevance, whether there is a relevance to have a human biology. These points, very important points, are missing. And protocols, registration, I have to provide a statement indicating whether a protocol was prepared before the study and where this protocol was registered. So these are the important points are missing. And data access, where these data are available is also missing in this paper. So to conclude, my opinion is the data clearly points out the advantage of adding ashwagandha along with protein cocktail for increasing the muscle mass in aged rats. This demonstrates the potential for the application in elderly humans. And the discussion on the mechanism of action is well formulated on the basis of rigorous review of previous work. 7 out of 10 mechanisms which are contributory to the aging process are addressed in this paper. And the thing which are not seen in the paper is research questions, which is not clearly defined. And I feel a complete profile of relevant phytoconstituents of Vitaenis somenifera would have been included as was done for quinoa and whey protein and soya bean. And it would be good if the study follows ARRIVE guidelines and does not an animal study design need justification when human study is feasible and relevant. So to fulfill the replacement criteria over here. And when multiple groups are involved in an animal study design, does not inclusion of each group require proper justification to fulfill the reduce R's criteria. And the discussions and conclusions are not formulated adequately with the reference to the findings. And statement on adverse events with limitations and bias could have been included in the studies. So I acknowledge Dr. Vandana, author of the paper, for her guidance and inputs from her side, and Dr. Supriya ma'am, from Associate Professor and Head Metabolic Disease Research Unit, her valuable time and her guidance and advice on each slide, which helped me to get clarity on the paper. And Dr. Ram Manohar, Research Director, Amrita School of Ayurveda, to understand the paper in depth and to understand the sample size and its relevance in making the grouping of the animal study. And the Tennavan from Amrita School of Pharmacy and Amrita Vishwa Vidyapeetham is valuable inputs, and all the JC Club organizers, Dr. Girish sir and Dr. Vinay Pawar and Charu Sharma ma'am for their continuous effort and their moral support in presenting this paper. And I thank to Gopi Krishnan, the PG student of Amrita School of Ayurveda, who finished his animal study recently. His experience, practical experiences, and his difficulties he gone through during the studies, he's helped me a lot to understand this experimental study. And special thanks to my colleague Dr. Shyam from the point of selecting the paper, presenting the paper, understanding the paper, and analyzing the paper till the point of presentation. I heartily thankful to him, and I thanks all of you for your patience listening. Thank you.
Thanks a lot, Dr. Sushma. Thanks a lot. It was a very good presentation. You started with the pictorial presentations were very good, right, actually, and you have you have evaluated the paper critically on the basis of experimental research, or how experimental paper on experimental research is to be written, and according to arrive guidelines also. So it was a very good presentation. Before going to discussion and before going to question answer session, I would like to welcome Dr. A.B. Vaidya sir. Honorable Dr. A.B. Vaidya sir is with us for this journal club. Dr. A.B. Vaidya sir, Research Director, Kasturba Health Society, Medical Research Center, Mumbai, who has conceived a pioneering and promising concept of reverse pharmacology for the first time. I welcome Dr. Ashok Vaidya sir. Welcome, sir.
Thank you. Thank you.
Thanks a lot, sir.
I think Prahlad is starting the discussion. That would be appropriate.
We have Dr. Prahlad Patki sir, Senior Pharmacologist from Bangalore over here. I would request sir to share his views. Dr. Prahlad Patki sir.
Thank you. Good evening. It was a nice afternoon turning into evening, I think. Good presentation, good discussion. My first point is, though the paper does not give any positive impression of any particular groups being superior, this is a nice thing. Even if the results are not completely positive, shall I call them negative, but still it has been published. That's a nice thing. Second, all the 7 groups were required. But my only thing is, if you wanted to have an aged population of animal, something more could have been done. See, what happens is aging is going to occur, and there are many factors which are going to modify this aging. Some of us age faster, some of us may not age faster at all, or maybe we may take some more time to age. That means for these experimental animals, if you are giving them all the environment, and Dr. Sushma was telling that we also should provide them toys and all. If all these things are being given, the aging process itself is going to be hampered. That means you have not taken a classical animals which were really aged. That means we could have gone little bit ahead rather than say 18 and 20, 16 to 18 months or so. We could have gone little bit ahead, I think, so that those animals could have been taken which were definitely genuinely aged. That is one of my point as such. Next important point is the confusion is regarding the proteins. Now, proteins are present whatever diet you are going to give to the animals. That means whatever the diet the animals were giving free at Lebanon, that also might be containing some amount of protein. That means whether that protein was sufficient for these animals to prevent the aging or to improve their grip strength becomes difficult to understand. This is my another point, I think. Then that means if you had estimated the protein, how much was present in the diet, which the animals were getting already, that would have given us some feeling, my last point is the nature is going to govern us whether we like it or not. All of us are going to age. Is it possible to prevent this aging? Impossible. Now, is it possible to postpone at least this experimentation with the criteria of animals which they have taken? It indicates that whether you give something or the other, the process will be normal. That means good amount of exercise, and second is good environment, what has been provided in these experimental animals, and adequate amount of protein itself will be sufficient to improve your living, I think. This is my conclusion from this article. Dr. Sushma, you have done a nice presentation. Thank you. Thank you, sir. Dr. Vaidya.
Thanks a lot, sir. Sir has shared his views on negative findings of the paper, why 7 groups have been taken over here, and what do we require? Like sir said that aging is, to prevent aging is not at all possible. So we can postpone the aging, or we can have a better living by properly managing exercise, good environment, and protein diet, right? That is the point that sir emphasized in his views. I would request Dr. Ashok Vaidya sir to share his views. Dr. Vaidya sir.
Yeah, firstly, I would congratulate Sushma for doing a really admirable job, and that too getting in contact with the author, with other seniors, and the way she structured her presentation was wonderful. Basically, it is an ethanolic extract, and we have worked with the aqueous extract. And in the same journal, GIM, we have paper in 2012 of volunteer study in the same journal, which has not been cited by the author. That is really not understood by me, because Hingorani has been also our collaborator, and he provides standardized sample to us also. And in that paper in Volunteer Prahlad, it is interesting that they really use the dose, escalating dose from 750 milligram per kg to 1250 milligram per kg. Muscle strength, muscle power, all were improved. And there was also a tendency for fat reduction and lipid reduction too. And at that time, we did not want the further study in humans because there are limitations in humans. But currently, we are doing an excellent study at Tata Institute of Fundamental Research, where we are studying it in the neuronal cultures. And we have some very interesting unpublished data, which would be shortly published. So what I feel is that basically aging cannot be only prevented, aging can be reversed. And now enough data are available, and this week's Nature an excellent article on reversal of aging. It's a big news item actually. And what I request that all of you at least should scan the headings of Science, Nature, some of these journals which are truly keeping up to the latest data. So aging can be reversed. And when we talk of aging reversal, Kayakalp comes to my mind. Prahlad may not be aware of this, or many of our modern oncologists are not aware. But there have been people who have lived up to 185 years, 125 years after Kayakalp, documented Kayakalp, and documented, written by judge of high court also. So what India has to offer is not only muscle mass, because Dr. Rama Vaidya has worked on sarcopenia for many years. And we also feel that doing so many markers at a time itself is too good to be believed to be true, frankly. I'm very sorry, but I know Vandana very well, and I respect her also as an author and a scientist. But it's better, as Dr. Prahlad said rightly, that even aged control should be taken, not young controls only, but aged controls and so many things Prahlad says are needed. I don't agree. You get good control, larger number, sample size, and you distinctly show in selected parameters. And that's where I think some of the criteria are not taken. For example, fat infiltration, lipid infiltration inside the muscles. This is very critical for muscle, not only muscle insulin resistance, for HOMA coming positive. And this intramuscular fat, they have not demonstrated at all increase in the agent, which actually occurs. And whether that was reduced. Second very important part is adiponectin. Because with this intramuscular fat increase, there is also increase in adiponectin.
No,
And
decrease.
Decrease in adiponectin, and that leads to the insulin resistance. Very important part is that we embark on taking medicinal plants without truly studying the Ayurvedic strengths and the Ayurvedic usage. And that's why reverse pharmacology, to my mind, is very important. You have to sit at, as Sushma knows very well, you have to, both modern and Ayurvedic people should sit together, discuss their experience. Even exchange data on the cases also, as Rama Madam had some inter-system dialogues of 5 systems on PCOS. When you discuss like that, then ideas emerge that what is to be done. For example, we found in volunteers that some of our volunteers were sedated with this dose. Now, when they are sedative, they can't do driving. So some of the things are very important, but I think that before taking up study, a general advice is that Ayurvedic physician, modern pharmacologist, and even aging experts, I don't see a single geroscientist here. Not a zero, because geriatrics is a huge group by itself. Geroscience has emerged as a specialty. And that's why in the entire paper, there is no discussion of sinusoids. Now, sinusoids are cells which are not apoptotic at all. They hang around, they secrete all these inflammatory cytokines, and that's one of the major cause of aging and even cancer and even chronic inflammation. And some of our Ayurvedic drugs which contain quercetin would be working because quercetin is one of the first senolytic drug. And I feel that focus of Ashwagandha, in my mind, should be by neuroscientists. Because the best effects of Ashwagandha we have seen in clinical trials, as Sushma rightly mentioned, clinicians who have done it also. And I feel that psychoactive properties of Ashwagandha, different extracts very important. But what we found with aqueous extract and alcoholic extract, the concentrations of the actives will be different. Phytoactives will be different. And I personally believe that it's a first beginning. Congratulations, author, more congratulations, Sushma, for bringing out the plus points and negative points both. And what I liked was her bringing the plus points, strengths first, then only gently mention some of the weaknesses and end up by strengths. Because that to me is a function of a good critic. First talk of positive, then they build trust. Something happens negative, 1 or 2, why not gently tell that? And then again turn to the positive of the paper. So I will do the same. I think that Ashwagandha, to my mind, like Tinospora, Cordifolia, or Amruta, I'm happy to remember Amruta as Ma Amruta, the way where you come from, Sushma. Give my pranam to Ma.
Yes, sir.
And now Sujit is working with us, Dr. Sujit Nair, who was at your institute. So I will say that this kind of studies our pharmacologists have taken up on more. And in past, they were taking only plant extracts and do something experimentally. First, I have sat with great Vaidyas, people with huge experience, with such seniority, such expertise, such knowledge of Shastra and experience actually. Then I start a trial after I see observation clinical results. So these are my brief comments.
Thanks a lot. Sir has emphasized that aging cannot be only prevented, but it can be reversed. Like we can get paper from Nature, which has got published in Nature journal on this reversal of aging also. And sir has pointed out the points, positive as well as negative points of the presentation and the paper actually, and how Dr. Sushma has done a very good job from her point that for the presentation, she has taken her efforts in presentation and overall this work are felt and can be seen through a presentation from today's presentation. And sir has mentioned one point that when we are working on such papers like for aging or muscle mass, we should have a collaboration of Ayurvedic physicians, medical pharmacologists, as well as geroscientists. Like geroscientists obviously will play a significant role in this process and publications also. So I'm thankful to Dr. Ashok Vaidya sir. There are some questions. I don't know, there is no one from author side, but there are some questions in a chat box and question answer also. So we'll go through this question answer questions which we have received in chat box. Dr. Sushma, are you there?
Yes, sir.
Yeah, okay. So the question is asked over here. Findings are true for smooth muscles too. Are the findings true for smooth muscles too? Because the findings here are given are skeletal muscles. So what do you think about smooth muscles?
Actually, sir, if you consider smooth muscles, we have to see the cardiac muscles, respiratory muscles, all such things. No such criteria were considered in this study. But I saw one paper where the clinical trials in human is done on this area actually to see the muscle strength in these areas. So, but in this paper, author is not considered actually about this.
There is one more question. There is one question. Have they tried to apply Ayurvedic parameters? I think the answer is no. Yeah.
No. Actually, even the Rasaguna Viri of Ashwagandha is not assessed in this paper. Actually.
Yeah. Dr. Raju Adekar is asking that one criteria: Ashwagandha is immunomodulatory. Pre-treatment may cause autoimmune response, and long-term therapy of Ashwagandha may lead to liver problems, stomach upset, etc. Therefore, one need to standardize the dose for long-term therapy. He has shared his views actually on the paper. What do you say, Dr. Sushma, on this?
Sir, if you see the clinical trials, sir, I saw one paper, the duration of intervention of Ashwagandha is 60 days. When I saw the dose fixed in the studies, 1,250 milligram actually. So up to that point level, we can take the dose of Ashwagandha. So it proves that there is no side effect in this study actually. So I feel with that paper only, that's why the dosage of each clinical trial mentioned in that slide actually. To show
May I come in, Vinay?
Yes, sir. Yes.
Yeah, yes. I feel that the immunomodulatory role of Ashwagandha is a very debated issue. Maximum work done on this is by Serum Institute of India, which is currently making all COVID vaccine, and Bush and Patwardhan's group. And they have found that actually it enhances the antibody production. The same dose of antigen, lower dose actually has a higher antibody response. So in my feeling, even natural infections may get higher antibody response. And I don't think Ashwagandha, to my mind, is immunosuppressant. So a toxicity of to liver, I have not seen any demonstrated effect, or the doses must have been used very high. and with some other drugs or molecules or something. Otherwise, I think it's an immunostimulant. Thank you.
Thank you, sir. One more question is there. Ashwagandha is in use as a single drug to improve muscle strength and tonicity in aging population since older time. What is the role of protein diet with ashwagandha? What is the role of high protein diet with ashwagandha? Question is asked over here.
So that's true. Very essential, very important question, sir. Actually, I had a very much.
You have asked the same question.
Yeah, actually, even I had a doubt why these many protein groups are used in this study, actually. And in the paper, I didn't find any rationale behind this, sincerely telling.
Yeah, and I like your query regarding that. There was one group which has received only RT, resistant treatment was given, and no protein diet along with RT was given to any of the groups.
Yes.
So that could have been done in the paper. Right?
Ashwagandha is a pleiotropic, has pleiotropic molecules. And pleiotropic activities are difficult to define in extracts.
Okay.
And that's why it is what aqueous extract does, was alcoholic or hydroalcoholic extract does, is very varying. And we still do not know what ashwagandharishta does. Because ashwagandharishta is a fermented product. And with fermentation, what changes occur in terms of the profile like MSMS, LCMS, these have not been truly attempted to that extent. But one thing is certain that this question was not asked, but I believe protein as such can improve your sarcopenia. There is no doubt about that. It will also improve the insulin resistance. And I think that authors have made a mistake by, they should have a control group, ashwagandha group with the same diet and a protein supplementation diet. Then they would have still come up with the same thing possibly, because they have come up with ashwagandha protein combination, also similar results. And I personally believe that sample size is too small. And very important part of protein supply is creatine synthesis. It is the creatine which is synthesized from amino acid, which you mentioned in your review also. And I think that those are used by athletes at present. They have been used in a massive nutrient of sports nutraceutical market. So they could have taken one of that, which is being used, and even elderly people with sarcopenia take it. And there are so many aspects of sarcopenia with obesity, sarcopenia with osteoporosis. And I believe that aging, our main aim should be neurological. Because primarily I believe that even muscle activity and brain activity are very related. Because there are studies showing that if you imagine doing exercise, then also your muscle mass increases. It's amazing for that, but there are studies like that where they have shown that doing regular imaginary exercise itself and what molecules exercise induce. So recently there was a paper citing my paper in JIM from USA in Feb's letters, where they had done load weighting. And they found that distinctly it has got some increase in dopamine, increase in melatonin. It's amazing. So I think that the neuropharmacodynamic effects are very relevant to the kinetic, whether they really cross the blood-brain barrier or not. We give this compound, but we have no idea which of them cross the blood-brain barrier, which do not cross. So I think that that's why pharmacologists in every college should interact with Ayurvedic experts, watch their positive clinical results, and then from that take up leads. I think India would be the world leader in new drug discovery and new drug development. But I congratulate Vandana for making a beginning, and I would request Prahlad and all my colleagues in IPS, Indian Pharmacology Society, to take up at least 3-4 plants, and we can become world leaders in drug discovery. Thank you.
Thank you, sir. There are some queries or comments are there in a comment chat box. The author of the research paper have not cited any reference or supporting document mentioned in Ayurveda. That part is missing. Vaidya sir has already mentioned the things about this, that there should be a collaboration of pharmacologists along with as well as Ayurvedic physicians for such work. A comment from the tables, somebody says that Meghna says that from the tables provided, it looks like in none of the major parameter did Vidania somnifera extract score better than the reference, that is whey protein. Dr. Sushma, can you throw light on this?
Yes, sir. So all the compared group, in all the experimental group, the author says in the paper itself that all group has given significant result actually. There is no difference in any group. There is only two difference I found is one resistance group, where we discussed already protein level of total protein, and in the second one CRP level in the resistance group. These are the only two changes I noticed. As to all the intervention group, the results were same actually. There is no much difference in the group itself.
There is one question. As per my knowledge, Dr. Murtidhar says, Ayurveda is person specific. According to its basic principles, one has to understand Prakriti, Agni, Koshta, etc. And if this is followed, there cannot be standardization to determine exact dose of the medicine. Please guide in this regard.
That's true. That's very much true, actually. That concept, we Ayurveda people has to follow that concept.
You have a tailor-made approach in Ayurveda, so obviously. Yeah. Purusham Bhiksha.
Yes, yes.
So the concept is there. One question is there. Many studies have been carried by different pharmaceutical industry on aqueous extract in higher animal models also. In this regard, have you come across such higher animal models, such studies in higher animal models?
Regarding Ashwagandha, no, sir. Sorry, I didn't find such papers. I'm thankful to the doctor who had sent a message on this. I'll surely go through that paper. Thank you for that.
The papers regarding the queries are there regarding about the papers that the Vaidya sir has mentioned. A reversal of biological clock restores vision in old mice. The link has been shared in chat box. And one more paper, exploratory study to evaluate tolerability, safety, and activity of Ashwagandha, Vidania somnifera in healthy volunteers. The link has been shared in chat box, the same by Dr. Charu Sharma. Sir was mentioning about that. And from this, we come to know that Sir has mentioned that how a review of previous work done is very necessary while planning for the study. If you are planning for the study or if you are going to write a paper, you should go through the things which have been done till date in our field, in the respective subject, in the respective experimental studies and all. So that is about, people are congratulating you, Dr. Sushma, for the presentation. It was a very nice presentation.
Thank you.
So one question is there, what about gut markers for Vidania somnifera, gut permeability? Inflammation, is that an axis worth exploring? Like about gut permeability?
Yeah, I think there is one paper related to this is published, sir, in the PubMed. Had I come across that paper, it had not gone through in detail as it is not necessary in this paper, but I found that paper. It is very interesting also regarding the gut related thing.
One question is there. Rasad Raktam Tato Maunsan Medas Tato teacher. We have a concept over here of Dhatu Parinaman Kriya, which Ayurvedic parameter could have been added. How Tvak Prasadan as Upadhatu of Maunsa can be assessed in animal model? Can you comment on this?
As Mamsa Dhatu Tvak, right, sir? Ashray Baba on the basis of no.
Animal model. How these things can be done in animal models?
Okay. I have to think on that, sir, actually. Yeah. If you see that in the instrument base, we I'm just thinking a bit aloud. We have a derma lab instrument, sir. In that, actually, we can assess up to the rasa, rakta level we can assess, and we have the elasticity probe also that will give the ruksha snigdha aspect of the skin. And I hope with this device, I think the idea which was given by the person, I think we can go ahead with such study, because that is a wonderful device. We just started working on that, and we are assessing all the 6 gunas corresponding to the dhatus, how it, if at all vata vriddhi is there, which guna is ruksha is there. So such a combination of work we have done so far in that, using that instrument.
Thank you.
Yeah.
Thanks for
I have
sharing.
only 2 points to mention.
Okay, sir.
When you have a huge clinical data for hundreds of years, before you go to animals, you have to see really what this thousands of years experience tells.
Okay.
And currently it is like this, not only past experience. Because watching them, probably the problem is that our pharmacologists in the country have stopped seeing patients. Most of them are MD in pharmacology, not MD in medicine, then PhD in pharmacology, or that combination, because clinical experience to me is the top experience. And as far as the models go, Prahlad sir rightly mentioned that there are very good models. There is a Japanese aging model. There is a progeria model. There are several models of aging. And I personally believe that if even a group is formed in IPS along with the Ayurvedic top institutions to look that as a task force in Ashwagandha, I believe that we will not have the problem we faced with Sarpagandha. Sarpagandha showed activity in 1931. And in 1950, my teacher, Professor Rustam Jal Vakil, showed its effect hypertension in British Heart Journal. And only in 52, 53, SIBA took up to take out reserpine. Now reserpine is dead. But Sarpagandha extract is still used in Ayurveda effectively because it doesn't cause as much depression as reserpine does. Yeah, brother.
Regarding Sarpagandha, it is trying to make a comeback, sir. The problem with Sarpagandha was the dose which was used was very, very high, very high. The dose of Sarpagandha or reserpine was only 0.1 milligram. People in those days were giving 10 to 20 milligram. That means it was natural to produce adverse effects. Now, there are some Westerners who are trying to bring it back, reserpine, not in the form of Sarpagandha, but reserpine, they are trying to bring it up. Last article I read was from the Archives of Internal Medicine. Interesting. Second, I fully agree with you, sir. Rather than going back to the animal experimentation where it is difficult to evaluate some of the parameters, which I think Ayurveda concept has given us, we should go ahead with the clinical evaluation, I think. Clinical trials, these things are going to help us a lot, rather than going back and then trying to find out which model, which clinical parameter can be used from Ayurvedic point of view into the animals I think is a difficult task. At least this generation will not be able to do. Then one more thing I had in my mind, we use a word called immunomodulator. I fully agree with you. What has been shown, we were one of the authors in that it has got a potential to improve the immunogenicity of vaccines. What else you require to take this further ahead as such? That means it might help us to come out with a better vaccine, especially when the variants are being seen, nowadays, when variants of many of the viruses are being seen, whether this is going to help us to solve that problem can be interesting one, I think. And the last point, to take away the word immunodepression, it is better to do a study comparing corticosteroid with ashwagandha to know whether both of them have got equipotent immunodepressant activity. If it doesn't have, the question will not arise in future. Thank you.
I like your comments very much. There is a molecule formed of reserpine which does not cross blood-brain barrier. And this molecule would not cause depression, but will lower the blood pressure. So the immense possibility of using natural molecules as kind of scaffolds for new chemistry, for new chemical entities is something why once we show clinically something is working, we must then go in experimental, absolutely cutting edge science, cutting edge molecular pharmacology. Because if we do that, we'll open up new fields. You know, Rolfia actually, Sushma may remember or not, I don't know. But Rolfia caused in 1931 depression, Parkinson's disease, galactorrhea, ulcer, all these side effects. And when did we develop the drugs for all these diseases in the modern pharmacology? By understanding the reserpine's molecular action of catecholma and uptake inhibition. So we can be world leaders in several areas by opening new knowledge systems. And that's why I'm a strong proponent of Indian knowledge systems. But I get beating from both sides. Because my pharmacologist friend say Ashok Vaidya, name Vaidya has become Vaidya, is forgotten in pharmacology. And Ayurveda people say that you have not studied Ayurveda, you are only 4 generations of Ayurveda, doesn't mean to know Ayurveda. It's nice, but I feel that a consortium can be made, Prahlad, and you take the leadership. You talk to our IPS leaders, and some of them are very open now, and take it up with Ma Amrutanandamayi, our research center, TDU, Pune. There are several very good centers now in Ayurvedic research also. Thank you.
Thank you. Thanks a lot, sir. Vaidya sir always tried to bridge a gap or tried to bridge Ayurveda and modern science through his work. So coming to the end of the session, I would request Patki sir to share his views or concluding remarks, to give concluding remarks.
Thank you very much for giving me an opportunity to come for discussion today. Dr. Sushma, it was a wonderful presentation. I think this should be shown to the postgraduates in all the sciences. What way a journal club has to be conducted. Wonderful, very nice one. Thank you, Pawar Sahib, for giving me an opportunity. Thank you.
Thank you. Thanks a lot, sir. As in Ayurveda, we say there are 3 means to acquire knowledge: Adhyayan, Adhyapan, and Tadvidya Sambhashana. Tadvidya Sambhashana comes with discussions. Like we can have friendly discussion as well as hostile discussions. In friendly discussion, it is said that Tadvidya Sambhashana, which is friendly discussion, Jnanabhi Yoga Samvarshakari Bhavati. It is said that discussion with experts promotes pursuit and advancement of knowledge, provides dexterity, improves power of speaking, and illuminates fame, removes doubts in scriptures. And we have experienced all these things in our 1.5 hour session of the Journal Club. And I'm thankful to Dr. Patki sir and Dr. Vaidya sir for this brainstorming discussion on different aspects of the article. I'm thankful to Dr. Sushma. Dr. Sushma, she has presented the paper in a very good manner. Like the content was very good, but as we know in Bhakti, Nirguna Bhakti is important. Like everyone wants to achieve that Brahma Chaitanya, that is Nirguna Bhakti. But to reach to that, or to reach the destination to Nirguna Bhakti, Saguna Bhakti is important. And thus she tried to keep the attention of the viewers in the presentation. She had a very good pictorial presentation, and thus aroused the interest of the viewers in the presentation. And all the viewers, all the audience was there till the end. And it was very good presentation. Pictorial presentations were very good. Positive and critical analysis of positive and negative points of the paper. She has pointed out many mistakes over there. And Dr. Patki sir and Dr. Vaidya sir threw light on overall experimental study. This experimental study, overall experimental studies, how they are to be conducted in collaboration with medical pharmacologists, Ayurvedic physician, gerologist, and all. And what is the future scope in this regard? What we have, and thus the aim of this journal club has been fulfilled. Before going to vote of thanks, I would request or we invite participation from PG, PhD student, researchers, faculty as a presenter for the next journal clubs. If you are interested, please let us know. You just email 3 articles of your choice to editor.jim@gmail.com with the subject line as participation in JIM Journal Club. So here we come to the end of this presentation of the Journal Club. I am thankful to Dr. Ashok Vaidya sir, Dr. Prahlad Patki sir, Sushma for this wonderful presentation, Dr. Girish Tillu sir, Dr. Kishore Patwardhan sir, Dr. Supriya Bhalerao madam, Dr. Charu Sharma, and the team who has organized or who have conducted the presentation, conducted the program. Thank you. Thanks a lot. Thanks to all of you. Thank you.
Thank you.
Thank you. So thus I declare that the session is over. Thank you. Thanks a lot. Thanks to all. Thanks.
There is an announcement. We all know that research is always getting nourished by various dimensions, and hence we have starting a new webinar series that is called as Musing Minds. And this webinar series will expose us to various dimensions of research, art, and so many things. As Dr. Vinay also said, that bhakti, there are several dimensions. And this webinar series will start from this 26th January, which is the 75th anniversary of our Indian Republic. And the first session will be delivered by Dr. Avinash Patwardhan, who is a trained gynecologist, but has touched various areas, right from mathematics, arts, painting, yoga, and several things. And we have shared the link for registration and a flyer of this webinar series, Musing Mind. So interested participants can register. Thank you very much. Over to you, Dr. Charu.
Thank you, sir. And we appreciate all your efforts, Dr. Sushma, and from Journal of Ayurveda and Integrative Medicine, you have been awarded a certificate of participation for presenting this research article, and you have inspired a lot of students, as we can also see in the in the chat box. So thank you for all your efforts, and thank you for being a part of this. Thank you so much, sir. Thank you, Prahlad sir. Thank you, Girish Tillu sir. Thank you, Vaidya sir. Namaste. Thank you. And I would also like to announce that our next journal club meet is on 19th of Feb. And we have Dr. Priyanka Chaudhary, second year resident doctor in pharmacology department from Government Medical College, Bhavnagar. She will be presenting effect of ethanolic extract of Rosa centifolia against doxorubicin induced nephrotoxicity in albino rats. And we will have this presentation on 19th of Feb. So inviting you for the same. Thank you. Thank you all. Namaskar.
Thank you. Thank you all. Thank you.
Thank you.